Hi, my name is Cal Beyer. I'm the Senior Director for Safe Workplaces at national nonprofit Safe Project. We have partnered with the Keystone Contractors Association over many years, talking about the importance of opioid awareness and mental health and suicide prevention. I'm a big fan of John O'Brien, and I appreciate the leadership that this association has taken on opioid awareness. We featured John in an article in the Keystone Contractors in forconstructionpros.com because as an association, you've been one of the organizations at the forefront. For this year's video toolbox talks, I'm going to do two sessions. The first is safe disposal of leftover prescription opioid pain management. This is an important topic, and our industry has done a lot to address the opioid crisis. Some representative examples are on this slide, and it's really powerful to see how we've unified together to help identify this as a risk and to take proactive actions. However, there are some limitations. Despite more companies using naloxone, we could do more to move this upstream as a prevention method if we were to educate employees about the risk of leftover pain management at home. There is evidence that shows, despite decreasing opioid prescribing rates, prescription opioids continue to play a role, and it's a major role in the opioid crisis. For the last 3 studies of the National Survey on Drug Use and Health, the rate of opioid misuse among the American population has remained steady, but there is some emerging data that shows the use of illicit opioids may be higher than was known previously. The Journal of the American Medical Association, JAMA, in a Health Forum article from May of 2025 said the initial source of opioid use in the past year has varied. Almost 40% of users cited prescription medication. 36% used prescription medication not prescribed to them, and 24.7% started with illicit opioids. This shows us the need to educate youth, young adults, and everyone in our industry about the importance of opioid leftover pain medicine being properly disposed. There are leading gateways for new persistent opioid use. I talk about this frequently. Chronic pain is one because of large doses of opioids that are prescribed to individuals with this real affliction called chronic pain. Number 2, prescription opioids for both on and off the job injuries. And then surgical procedures, medical and dental procedures. But the 5th leading gateway that I'd like to talk about is this diversion of leftover pills. This is a way that each family can protect ourselves and our communities from leftover pain medication. This is an important issue. There was a study by the Journal of the American Medical Association in July of 2022. It was in the state of Oregon, and it was over 840,000 patients. It looked at the risk of overdose in a household when there was opioids prescribed to a family member. With the first opioid prescription, there was a 60% increase of a household overdose. With the second and subsequent prescription, that risk increased by 625%. So as risk management, safety-minded professionals, this is a call to action that this exposure is real and that steps can be taken and should be taken. What John O'Brien asked me to cover were some tools and resources to help educate our workers and families about this risk. One of the tools that I've used is called Remove the Risk. It's from the U.S. Food and Drug Administration. It's about safe opioid disposal, and it is a toolkit to be used for outreach. This slide is busy, but I wanted to show you, if you go to that URL, you can find social media graphics, sample posts, fact sheets. You can even see radio and video public safety announcements. There's posters and postcard examples to help you spread the word. And I've given you two versions where you can go to that website and click on the link to share this Remove the Risk, both in English and in Spanish. This is a powerful tool, and it's one I wanted to bring to your attention. Remove the risk. A second opportunity to protect our families. This is more for home use than the workplace use, but there are examples of medication lock boxes. This is a company, and it's one of many providers. It's just an example I wanted to share with you. It's called RX Guardian. I liked it because there were simple ways of showing you a prescription keypad on top of a medication bottle, and then a safe lockbox that can hold multiple in the middle. And the third is a locking cap that would fit over prescription pain medication. One of the risks that I've seen leading to accidental poisonings of children would be people not filling prescriptions with childproof caps. So I'm always encouraging people to put medications out of reach, high medicine cabinets, but for added protection, thinking about secure medication lockboxes. These examples from RX Guardian are one of those examples. Another process that we can use to help reduce and eliminate the risk is drug take-back programs. There are several ways of doing this. Pharmacy chains continue to have kiosks that are confidential, anonymous, free, and they have that drop box. So you can put your medication in and it safely drops to the bottom. It cannot be retrieved. Usually they're in an isolated area, but still near the pharmacy. And this is a way to help provide safe disposal of leftover medications. This is a link to a website that has a locator tool, and it's from the National Association of Boards of Pharmacy, NABP. This is a reliable source. I happen to list one example from Walgreens. I see them at CVS. I've seen them at some Walmart stores. There are many examples of chain pharmacies that do this. I've been told there are well over 1,500 locations. I bet it's more, but they don't get the use that they should and could. So this is an opportunity for you. Fill in your address or your zip code, and you can search for local pharmacy chains. This is for an individual use. An employer should not take possession of other prescription medications. Refer this to family members. And in that vein, I wanted to say the Commonwealth of Pennsylvania has very good information. They have a locator as well. And you'll see Pennsylvania has identified at the county level over 900 prescription drug take-back locations. So I wanted to share a really specific state or Commonwealth specific resource for you. And that's the Commonwealth of Pennsylvania Prescription Drug Take-Back Program. You'll notice I've given URLs at the bottom of each of these references. I wanted to make this easy for you and for the association to share information. Nationally, the DEA, Drug Enforcement Administration, does a 2-time-a-year drug take-back program. Generally, if not always, it's been in April and October. And this continues to be a major success nationwide. So you've got the URL, and they also have a collection site location service. You can do that by zip code, you can list it by county, and then you enter state, and it will give you information. They also have other resources on that website, but I wanted to just share with you in one page a simple resource from the DEA. I'm always amazed. They publish the results of their semi-annual take-back collections, and it's, I believe the last one was 310,000 or 310 tons of leftover pills. Think about how small individual pills or even prescriptions are. It's a significant amount being removed from public possible consumption. Now, I wanted to share this article as well. The CEO at Safe Project, Jeff Horwitz, I'd partnered with Jeff for 3 years prior to joining the staff in March of 2024. And Jeff was one of the leaders in this area of drug deactivation. and drug disposal, home-based products. And I loved his knowledge and passion. I'd been aware of one of those products, but thanks to Jeff, I became aware of a family of products. We wrote an article about it. In that same series, I featured Keystone Contractors Association and John for your leadership. This was called Opioids in Construction, How Home-Based Drug Deactivation and Disposal Can Save Lives. So you've got the link to it. It was April of 2024 we wrote this. And this is an upstream example. Some companies are sharing one or more of these products as they do a toolbox talk, and then encouraging the employees to go to their homes, scour the home, look for leftover prescription pain medication in medicine cabinets, in closets, in chest dressers or armoires where you might store leftover pain medication. Do not save this for a rainy day. There's research that shows people use only about 30% of the pills that are prescribed. So encourage doctors to prescribe less amount so you have fewer left over. And there's also evidence that shows upwards of 90% of Americans don't properly dispose of leftover pills. This is a real opportunity to decrease exposure in your home, for your family, for your loved ones, and even in your community. So I wanted to share an example of what those three products look like. There's different products for different uses, and they each have different price points. We see them available online. So happy to share with John additional information about each of those three brands, so you're able to source those products. Deterra is one of those. That's the pouch. It comes in different sizes. And it is something that you add water, you add your medication, and a chemical reaction occurs. It neutralizes the chemicals and then makes it safe for proper disposal. Each of those devices works similarly, but differently. The little bottle is a product called RxDestroyer. It would be available if you have a recurring prescription and you're going to have leftover medication. And this would be something you would use after a dose, or if you had multiple family members that were taking prescriptions for one reason or another, it would give you an opportunity to address it that way. And the third product is called DisposeRx. What's been interesting is some pharmacy chains in some states have a partnership with DisposeRx. And the first time you fill an opioid prescription, they're dispensing or co-dispensing a DisposeRx product. This is an innovative way, though, during a toolbox talk to share one of those products and to encourage your family members of the workers to look through their homes, properly safeguard their homes from leftover opioids. So I wanted to share with you 5 last key takeaways. Educate your employees on the importance of safe disposal of leftover opioids. Do a toolbox talk on opioid safety awareness. Talk about those leading gateways. Teach employees to ask doctors, dentists, surgeons to reduce the number of opioids prescribed per prescription, decrease the number of refill possibilities, and then look for alternatives to opioid through better pain management. Number 2, if you're going to have opioids and other medications in your home, tranquilizers, sedatives, sleep aids, etc., consider medication lockboxes to protect family members in homes. A third, teach employees about the pharmacy kiosks to support takeaway or take-back programs. Continue to support DEA, Drug Enforcement Administration, and local law enforcement efforts with their semi-annual drug take-back programs. And then the fifth one is, again, the importance of that opioid safety awareness, and then consider providing sample product of Deterra, DisposeRx, or RxDestroyer to help support your family members in your workplace to reduce this risk of household overdose risk. Remember the importance of having Narcan available at home, in the workplace, and on job sites. If you're looking for additional information, any resources relating to naloxone, don't hesitate to reach out to me. Again, I'm Cal Beyer, Senior Director, Safe Workplaces at National Nonprofit Safe Project. Thank you again, Keystone Contractors Association, for 2025 Opioid Awareness Week. Kudos to you. Best wishes, everyone. Thank you.